My name is Atiemie Andrew, and as you know, we don't have all the time, so we just quickly go over to my guest in the studio. Daniel Edwin Atiemie is a national president, Primary Healthcare Workers Association of Nigeria. He is also a primary healthcare worker. Sir, good morning. Thank you for joining us.
Thank you, Mr. Atiemie Andrew.
Today we are looking at the state of primary healthcare facilities across the state. But focus, Abua Odua local government comes into focus, but then we'll also touch on other councils and figure out what the state of the primary healthcare facilities are. The question to you who's listening, if you are on Facebook at Nigeria Info 92.3 PH, let us know what the current state of the primary healthcare facility is in your area. Is it functioning fully? Do they have drugs, equipment, and all the other things that a hospital should have at that level? Share that information with us on Facebook at Nigeria Info 92.3 PH. Please, when you do so, state the name, the community, the local government where the hospital is located. Very important. I'll go over to my guest now, Mr. Atiemie. Let's start with primary health care in the state general. What's your view? You are work at that level. Over the years, can you say we have made gains in that area?
Well, primary health care in River State, service delivery in River State, I would say we've not done so much, but we have been in the trying end. Though recently River State won, emerged as the best in South, and then second in Nigeria.
Oh, hold on. River State emerged best in South for primary health care delivery.
Yes, service delivery.
And the primary health care service delivery in River State is not that good.
It's not that good.
So that would mean that in the South it is really bad for us to be coming out tops.
Yes, I will tell us the reason why I said it's not that good.
Why?
Yes, primary health care service delivery in River State is not all that good when, especially in the time of the then governor of River State, Chubike Rotimi Amechi, who built a lot of infrastructure in the primary health care sector. And then these structures were abandoned. I would say it the way it is.
Pause. After the structures were built, I've always been very critical about government building structures because they do the same thing with schools. They build all the structures, build all the schools, but then the system to keep it running, they don't put that in place. Was that the case for the hospitals? After they were built, were they well equipped and were they ran effectively? Or we just had like a structure that was built, but the system of running it, we hear that no syringe today, no drug tomorrow, no light next tomorrow, no this. Was that the case, or was it everything was put in place effectively?
The one for primary healthcare sector, the structures were built, well equipped and furnished to the state of art structure. I will call it that way. And Rotimi Amechi built model primary health care are categorized into three. There is one we call the model primary health center. Another one is the the comprehensive primary health center, and then the health post at the rural area. So the model is the highest and the best, followed by the comprehensive health center. So Rotimi Amechi, in his days as governor of River State, built model primary healthcare centers in the 23 LGAs, some local government numbering up to 5 of them. And then these structures and the building, the whole system was abandoned for up to 8 years or so. And then It's recently that they've earmarked 94 of them in Rivers State, in all the 23 local government, 98 of them for renovation under
for the
this
model
present
primary health care.
Exactly.
What
exactly.
about the health post? I think that would be very important. What is happening there?
The health post is nothing to write home about. As a matter of fact, the health post supposed to be in every community. Every community supposed to have a health post. But as I speak, there are some communities that don't have a health post, although workers, staff are posted to those communities, but they don't really have the health post and the structures to work with.
Break it down again. You said model primary health care. That's what we know.
Yeah.
And then after that,
the comprehensive health center,
and then the health post.
And then the health post.
The what is it the job of a local government or state government? At which level? For the model, I would assume that state government has powers, is responsible for that, or are all of them responsibilities of local governments to handle or take care of or maintain?
Primary healthcare service delivery is in the purview of local government system.
I needed you to say that so that we can clarify for people who are listening.
Because it is the third tier of
government.
Of
healthcare,
health service delivery.
So then, how is the relationship between local government chairmen and that sector over the years? If it has that much decay, everybody blames the state government, forgetting that local governments get monies. There's no administration of local government chairmen that have said that they did not receive their monies. All of them say they received the monies allocated to them. The question then is, how come we don't even have health posts like you've mentioned? The comprehensive level is almost nothing. The model level that we think, okay, should be functioning is also not in a very good state. You'd respond to that question immediately after we come back from a short commercial. Let us know what your thoughts are on Facebook at Nigeria Info 92.3 PH. What is the state of the primary healthcare facility in your area? Do you have a health post? I think some people are hearing this for the first time. After the break. News here. My name is Atiemie Andrew. I'm speaking with a primary healthcare worker and also the national president, Primary Healthcare Workers Association of Nigeria. He is based in Abua Odua. Before the break, we're talking about the relationship between the council chairman and these hospitals. I would like you, before we go any further, Mr. Atiemie, to elaborate for us how the primary healthcare structure works, because you had said that it's divided into three categories: the model, comprehensive, and the post. How is this set up, and how are the council chairmen supposed to put these things in their various councils?
Okay, like as I earlier said, the primary healthcare is the third tier of health service delivery and is divided or categorized into three segments. The model primary health center, which is
the very popular one, everybody knows,
which is the highest, and then the comprehensive primary health care center, and then the health post. Now, the way they are distributed in every local government is that the model health center stays at the local government headquarters and also the district headquarters. You know, there are all local government also have districts. For example, Abua Odua has 7 districts. So each district ought to have a model health center.
So this explains why you see people say, "Oh, the health center is far from where we are."
Yes,
it is because the health center is supposed to be built in their community, but it's supposed to be located in that district where they pick. They have like a location they pick for it. Or
exactly. So the model health center is at the local government headquarters and each of the district headquarters. Then the comprehensive health center is at every ward. Every ward ought to have a comprehensive health center. But as I speak with you, there are some wards like Ward 9 in Abua Odua. We don't have a comprehensive health center.
How many wards have that in Abua Odua?
The wards that have...
When you say they have it, like it is fully functional.
Yes, yes. I'm talking about practical issues.
Yes,
yeah.
How many?
So the wards that have comprehensive health centers are only 4. In Abua,
how many wards are there?
We have 13 wards in Abua Odua, and 4 wards have comprehensive health center. Like Diokpeden has a comprehensive.
I need to understand this. So for over 20 years, because we're taking like the Amechi time to the immediate part administration.
The
council chairman, the various council chairmen that have occupied office in that time have not been able to plant a comprehensive
health center at the ward level.
The ward levels.
Not even talking about the
I'm
post.
talking comprehensive. They've not been able to put a comprehensive one in the various wards, the various 14 wards of Abua Odua.
I will even talk more in the area of neglect to the primary healthcare system by the local government, both manpower, the system, and the structures. I will visit that area.
Go on.
Now, in the health post, every community, no matter how small a community is, ought to have a health post. And remember, the primary healthcare system or service delivery is the most important healthcare system in the world. If you neglect primary healthcare, you have neglected the entire health system, because it is the system upon which every other health service delivery rests upon. For instance, if you need the areas of preventive health, you don't need to go and then crowd BMH or UPTH, all those tertiary health institutions. You don't even need to go to the secondary health where you have general hospitals. our hospitals are unnecessarily crowded. Somebody who is suffering for headache, he didn't rush to the first point of call, because the health system is referral in nature. You have to rush
to go to the post
exactly
first.
You have to go to the post, the nearest to you, which is the grassroots, to the post or a comprehensive health center. You make your complaint. If they cannot resolve the issue, they quickly refer you to the other level of healthcare. Yes, healthcare system, until to the tertiary health institution. But you see somebody who feel malaise, that is feeling as if you are sick, and the first thing, run to UPTH or BMH, thereby unnecessarily crowding the system. Now let me come back to this other area,
the post.
Yes, to the post. Most communities, like Adada in Ward 9, I can speak with facts and figures how Adada in Ward 9 don't have a health post. What is used is a structure built by Shell as a guest house, and then they just post workers there, and they are managing the system. But to say this is a health center or a health post built by government for the purpose, there must be a particular design.
There are budgets that are forwarded to the councillors,
and also a design,
and a design, all of these things. So what is the assemblies at these councils and the councillors there? What are they then doing if these things have not been there for years, and then you don't have people speaking, calling the council chairman to order to say the budgets? How do they then implement the budgets that they have today? What is allocated to health? Do you have any idea? Under this administration now at the local government, Abua for instance, what is for the budget for health?
I'm not aware of that, and I wouldn't say what I don't know. But I know that the entire budget comprises of that of healthcare service delivery. Now, the area of funding, when Amechi was a governor, they enacted a law called the River State Primary Healthcare Management Board Law number 10, 2010. That law, among other things, are to address the issues of healthcare workers' welfare and the management of the system. As I speak, that law has non-implementation, partial implementation, and then selective implementation.
How do
now the area I'm saying none. There are some core issues in the law, core sections or provisions in the law, they are not implemented. Then the partial, some of them they will choose, like the area of funding. The law said 10%. They decided, the local government council chairman decided to give 5 to the primary healthcare management board, 5%. Now of the allocation, can you see how to tell you that health allocation of funding is very large in anywhere in the world because of the importance of the job or the service delivered? So
what are the council chairmen doing with the money? That's the question now. If the idea of governance is to, I was one time talking about how, yes, fantastic, we have council chairmen buying cars for councillors, which are good things, but giving bonuses. But what you're saying now sounds like the core issues that need to be looked at and addressed. We're celebrating 100 days for some of these council chairmen. In your council where you operate, and perhaps your colleagues in other council, what has been done in the primary healthcare sector that you can say really is a signal of transformation to come?
In my own council, where I work in Abua Odua local government, recently the chairman came on board. And is renovating a few number of the health centers.
Which of them? Model or comprehensive?
Model health center at Emelego, which is the headquarters of Odua. You know, we have Abua stroke Odua.
Yeah.
So the model health center is sited at Anyo, which is the district head of Aronya. One is sited at Emago, which is the headquarters of Kogbo, and then this one sited at Emelego community is the one at the Odua. So the chairman recently is renovating that one, and then other one at Ottawa. That is all I know. But for now, no one at the health post, no health post is being renovated, or no attention so far has been given to any health post or comprehensive health center. Although during programs to immunization, all these ones, the chairman of council normally subject to application of these health workers, they normally give them funds, to fund the system. But let me come back. The whole system is worrisome in the sense that the law is not properly implemented in the area of funding. The primary healthcare sector is inadequately funded by local government chairman. Now, I want to generalize. Recently, it is only in Ahoda West, the local government chairman there have, entered into renovation of some model. Many of the model health centers, comprehensive health centers, and also the health posts. But the issue here is that this money, it goes to the board. The board too also use part of this 5%, go to the some health centers for renovation and then medical supplies where you need hand gloves and some of primary healthcare system. The way we operate is free of charge in Rivers State by the policy of government. Is free of charge.
Explain that again so we get it. Free of charge to what degree? Is it free of charge regardless of whatever ailment you come to a primary healthcare hospital with, or free of charge to, is there a degree to which it is free? Yes,
at a point in Abua Odua local government, when Honorable Udi Odum was there, they did what is called free medication. The government buy all the medical supplies, that is the drugs, and supply to the health center. So they are dispensed according to the diagnosis and need of the patients. When patients come, they diagnose and they dispense these drugs free of charge. Then there came a point, every average Nigerian has a mentality that anything that is free is not too important. There came to a point they said, okay, the people should get this drug at a very minimal cost. So that I appreciate. Now, let me come back to the law. That law, as I speak, is all law cannot be implemented because the utilitarian is the greatest the happiness of the greatest number of persons. But in the case of primary healthcare, The law now is to the happiness and joy of few persons and to the detriment of the greater number of persons. So the whole thing is opposite of what the framers of the law intended.
We have to take a few calls. I know there's still plenty of questions I would love to ask and stuff I would like you to respond to, but time is not our friend. So Sukari Alex says, I'm from Joint Karama. There is no health center. I understand the dispensary was in JK3, but I can't say how bubbly that still is. Joint Karama is a ward, and it is a cottage hospital built by SPDC that's at JK4, which doesn't even serve its purpose well. Sick people are always rushed to either Okolobri or FMC Yenegwa because even the healthcare center in Akinima is near dead. This is now from Outer West. Tekena, just imagine that they have to go to Yenegwa by outside state. Executive Secretary of I can't take all of this. This is too long, unfortunately. Sorry. This person says there is a primary healthcare board law. Yeah. We know. We talked about that. Why are the infrastructures not maintained? It's actually supposed to be 10%, but then they are giving 5%. And even with the 5%, we can't say too much, according to my guest. 0817-923-0002, 0817-923-0003. See if we could take a few calls, take a few questions from you, and then we wrap things up as quickly as we can. Good morning, presenter. My community in Kana local government has neither a health post or health workers, nor health workers posted there. This has been the sad case for as long as the community has existed. Several other communities in local government area are in the same sorry state. Your name and where you're calling from, please. Good morning. All right, we lost that call. We'll move on to the next caller. You are aware that there are thousands of trained healthcare personnel who have graduated and are not being engaged or integrated into the system by the past administration. I hope they will do the needful now. This person says, good morning, Atiemie. Primary healthcare in Rivers State is a sad scene. Model Rivers State had, under Mechi, set up class envied by other states. There are doctors in all of them, but the wicked administration ruined them. In Joint Karama, there is no healthcare, but a dispensary in Odawu JK3. Nothing still happens there, and the councillors are not doing anything. That's where I'm also very worried. The councillors at the local government level, the assembly, what are they really doing? Good morning, Isaiah from Buguma. Please, let's keep it short.
Yes, Andrew, good morning. Let me greet the expert in the studio. Good morning, sir.
Good morning.
And let me also say that, Andrew, just as you rightly stated that what are the LGA chairman doing with the money? I think that question is one multi-billion question. They need to come and answer because health is wealth. And if your guest is now saying that it is only in 4 districts that they have such primary health centers, I think 9 out of
districts or ward you said
behind. Let the chairman
for Abua Odua district
judiciously dispense those money that is coming to the LGA and make sure that the health sector is spread across all the nook and crannies of the LGA.
Thank you. Emeka Inelele, good morning.
Yes, my dear brother, good morning. So, I want to sincerely greet the guest in the studio. Please, in my village, there is a general hospital there, lying there, over 25 years. It's a consultant, but I have 2 consultants. That general hospital is covering Ebeda, Alimini, Apabo, E2, Epremini, and Obudoga, and Ndele. For over 25 years, nothing is not functioning again. Please, I am begging your guests, you should talk to the state government, to the Minister of Health, to come to our rescue. Thank you and God bless you.
All right, Dakuku in the chair, quickly, good morning.
Hello, good morning, Atiemie Andrew. Good morning.
Quickly, Dakuku, quickly,
good morning.
please.
I want to ask a little question, Atiemie Andrew.
Straight to the point.
Yeah, guys in the studio there. I want to ask him, you know, when Amechi was in power, The primary health care in River State were functioning well. People were taking treatment free. But what happened? The previous government hold by Barrister Atiemie, which is current minister of LCT, the caretaker, the primary health care was being died, and all the whole caretaker and the chairman, local government chairman, we are not doing projects during his regime. But what is happening in River State? Why we supposed to get good health care in River State as a good state where we are getting a lot of money?
All right, Dakuku, thank you very much. Annie, in location, a few seconds. Let's hear you.
Okay, I get in the studio. Good morning, sir.
Good morning.
Okay, in terms of this healthcare of Atiemie, let me start by saying that even the local government chairman, they are not trying. I'm telling you. That is just one thing I want to complain about. Whoever I gave they give one position. He thinks that he has arrived. I want to make money for himself and his family. I will also blame the councillors that represent those wards. I'm telling you, I know even the primary health care.
Unfortunately, Annie, I think we have to wrap it up. We get your point. That's how much we can take. Mr. Atiemie, we have a few seconds.
Yeah. The area of emphasis is that no matter the structure, the good things you do, if the workers that are manning the system are not properly taking care, which is one of the problems of primary healthcare workers of River State. Last month, December.
Unfortunately, we're already out of time. We have to wrap it up here. Thank you very much, Mr. Atiemie.
For your quality personal lifestyles, home and office